Hey guys, welcome to our program project for 2025. I really appreciate you guys taking time to practice your sales messages and to share it with your team and put some effort into also learning some of the accounts that maybe you could spend some more time on and focus a new program on how to drive more business out of that account. So for today, I am going to focus on both the CCP program and the hip and knee program. I'm going to do both based on a primary care provider's office, because I think sometimes the program doesn't have to be quite as specific to maybe that said program. Like CCP, you can sell it in other accounts other than assisted living facilities. So I'm going to do it on an account that maybe might not be as traditional for CCP, just to give you an idea of what the purpose of this project is, to narrow it down to how do I sell this to an account that I'm trying to tap into, but also give you a chance to stretch your legs on some accounts that maybe you haven't spent much time on. So I'm going to roll right into the CCP program. So some of the prep work I've done for this project and selling CCP is I am going to focus on a PCP that I used to call on in San Angelo, Texas. His name was Dr. Chang, and his nurse, Mykayla, is my primary target for today's conversation and my practice role play. I know that Dr. Chang's office sees 900 plus fee-for-service patients a year. He sees a wide variety of patients, but I know that injury and poisoning, so like falls, are something common that he sees. I also know that with how old his patient population is, there's a chance that he is seeing patients that currently live in an assisted living facility. So per my Trella research and with my current conversations that I've had with his office, I know that I can sell CCP in his office in a version of CCP, right? Like, I'm not going to sell the 4 tenets of the program, but I am going to try to find a patient in an assisted living facility by selling my CCP program. So the collateral that I chose was the Why Choose Enhabit collateral. I love this because he can give it directly to a patient and it speaks to the patient directly. This is one of my favorites for talking about the CCP program outside of an assisted living facility. I always put a sticky note if I can, and just so that a way they can reuse this collateral later, but it directly speaks to Mykayla, the nurse that I'm trying to ask a referral of. I wrote, are any of your patients considering an assisted living facility placement? We can help those patients. They can have home health inside an assisted living facility. And if they're needing help with activities of daily living, then they need us too. Call me. And then I also put a sticky note on there saying, you can give this to the patient that you have in mind, but call me if you think of somebody else. This is just prep work. I'm gonna walk into Dr. Chang's office with this ready. Okay, so I'm in Dr. Chang's office. I've already gotten past the receptionist. Mykayla knows that I'm there, and I'm walking into the office ready to go talk to Mykayla. This is gonna be a really choppy, awkward role play, but that's just how a role play goes when you're by yourself. You just gotta practice, right? So, hey Mykayla, it's nice to see you again. I am so sorry I've missed you the last couple of weeks. Just before I get going, is today still a good day and time for you? Sure, it's not a problem. I've just been really busy lately. We all get that way. It's okay. I'm here because I really wanted to ask you some questions about some of your patients whenever they're struggling with activities of daily living. What do you and Dr. Chang implement? Like, say a patient's family member comes with them to the appointment and they're making comments like, you know, I'm really worried about mom staying home alone by herself. She can't cook for herself. She needs some extra help at home. And we're kind of considering finding somewhere like an assisted living facility for them to live in. You know, that doesn't happen all that often, but when it does, it's usually family members that are asking those questions. So, you know, we usually refer out to home health. Most of those patients usually are already on home health though. I figured you might say that. You send so many patients to Enhabit, so we're so thankful that we get to care for your patients. But I think we might be missing out on some of those types of patients, because I've actually never seen one of Dr. Chang's patients that are moving into an assisted living facility. I'd love to be a part of that process. We work with assisted living facilities all over, and we actually have area managers, like how I come in and talk to you. We have area managers that go into an assisted living facilities too, and they work with those nurses. They work with the care staff that's helping those new move-ins or those new residents that are moving into the building for whatever reason. Our team helps them with communication back to your office, saying like, hey, Betty White's not doing so great. She's, slowing down on some of her abilities to get to the cafeteria and have dinner, things like that. They communicate it back, and then sometimes we come to your office and ask for orders for physical therapy. And that's all fine and dandy, but I'm wondering if maybe between you and I, we could be a little bit more proactive and get ahead of the game. Do you have any patients that are maybe on the borderline of needing some placement in assisted living? They're just not doing as well by themselves at home. Yeah, I mean, we have some patients like that, but I might have to talk to Dr. Chang. I'm not sure if we have one recently. They're probably on home health though. Yeah, of course, and I hope that they are on home health. Let's think about this week. Let's narrow it down a little bit to who have you seen come into your office in the last week or two. They maybe had issues with transportation getting here, or maybe they had issues they complained about not being able to cook and clean for themselves. Is that something that has come up? Yeah, but I'm not so sure that they're quite interested in assisted living facility placement. That's okay. They don't have to be interested in facility placement. I'm just kind of narrowing down that type of patient where maybe we can help them, because if they're needing help with activities of daily living, then most likely they'd benefit from having home health. And since it's a free service, we can go in and see why can't they cook and clean for themselves. Is it because they are struggling with their mobility or struggling with their strength of just getting up and actually being able to perform the task? I think I might be able to find someone. Let me talk with Dr. Chang. That sounds great. Can I come back maybe this afternoon, or should I send you a text message and see if you guys have found anyone? Sure, that's fine. You've got my cell phone number. Just send me a text and I'll see if we can find somebody for you. Thank you. I really appreciate it. And of course, don't forget, here, I've got this piece of collateral for you. This is our Why Choose Enhabit Slick. If somebody comes to your office this week and they're worried about placement, let me make connections for you. We work in all the assisted living facilities here, and I can even make introductions. If they've got questions, we can get involved, and maybe in the process of them moving to an assisted living facility, we can come in and start providing that physical therapy before they even choose a location. Because if they're needing placement, most likely they're needing home health too. So here, you can give this to the patient. It even talks like all about home health, what services we provide, and I've even attached my number there on the bottom, and you can just give it to the patient and they can reach out to me directly. Thanks, Brittany. Appreciate you. I appreciate you too, Michaela. Hope you have a great day, and I'll be back later this week, but don't forget, I'm gonna text you this afternoon. Great, bye. Okay, guys, you do not have to do both programs, but because I'm your director of business development, I'm gonna do both programs. And again, I'm gonna stick with my PCP, Dr. Chang. I'm going to talk to Mykayla, and some of the prep work I've done for this call. Dr. Chang's office, I told you, has a ton of fee-for-service patients. He also sees a lot of osteoarthritis patients and fall patients. So hip and knee book should go, just like butter in his office. I'm sure he's seen someone like this. Prep work, I am working off of my quick flip. I'm going to use some of these hooks up at the top, or facts about our program up at the top. And then I'm going to pre-tab my book to page 30. And I'm going to go ahead and put my half slick in here, helping patients recover after surgery, just as a reminder for myself, so I don't like fumble through the book, Okay, as if I'm in Dr. Chang's office already, Mykayla knows I'm walking down the hallway. The receptionist let her know that I'm coming, and I'm gonna roll right into it. Hey Mykayla, it's so great to see you again. How you doing today? I'm doing great. What you got for me today? Well, I brought a new program for you. I know you and I have covered fall prevention 100 times, and I know that Dr. Chang sees a ton of osteoarthritis patients, right? It's like one of the most common joint diseases that there is. So I know Dr. Chang has to have one, right? Yeah, we see a lot of people with osteoarthritis. Okay, do you ever refer them out to ortho? Maybe they've had a knee replacement recently or a total hip replacement. Yeah, I mean, of course we see patients like that. Okay, well, let me ask you, have you seen anybody recently that maybe is struggling with that postoperative care? Yeah, we've had one a couple weeks ago. He had a total hip replacement, and I don't think he ever actually went to outpatient. Mykayla, that happens more often than you know. We work with some orthopedic surgeons in the area, and that happens a lot where patients think that they're going to be just fine after surgery. Turns out that new hip is pretty tough to work with sometimes. This gentleman, if we can maybe focus on him for a second, do you think that he would benefit from having some physical therapy at home? Yeah, I mean, he would. I don't know if he'll go for it, but yeah, he would benefit for sure. Okay, well, let me tell you a little bit about our program, and then maybe we can talk about getting him on services. So just like our fall book, we obviously focus on fall prevention, no matter what disease process we're working on, to be honest. But in particular, if we were to go see him, since he's had a new hip, we're going to teach him all about that new hip, what's to be expected, tips and tricks on how to stay out of the hospital, right? But we're going to teach him how to avoid falls with that new hip. And we're going to focus on what is his current range of motion, like what can he do, what can we teach him in order to stay out of the hospital, but regain that function. We want to help him get moving again, right? And movement is medicine. We know that. Well, I was hoping maybe we could chat and see if he is open to it. Would it be okay if I got a demographic sheet from you and we can reach out to him today? Yeah, I'll have the receptionist print off a demographic sheet for you, but I probably want to call him first because he's a little hesitant of anybody coming into his home. We get that all the time. I'll wait for your green light. But I will, if it's okay, let me go ahead and get his demographic sheet, and then I'll just send you a text this afternoon and see if he's open for it. That sounds good. Yeah, I'll reach out to him as soon as I can. Just send me a text this afternoon. That sounds great. Well, in the meantime, this is a little reminder. If somebody else pops up just helping patients recover after surgery, of course, hip and knee replacements are our, bread and butter. But if anybody is having trouble post-op, you know that you can call me, right? Of course. Thanks, Brittany. Okay. Have a great day. I will see you next week. Thanks. Bye.